Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Welcome to Medicare Moments with your host, Toni King, America's Medicare expert. Hi, Toni.
What you doing, Jim? And aren't we going to talk about Medicare's girlfriends today?
We are. We're going to talk about Medicare's girlfriends. IRMAA is one of them, right?
IRMAA is one and MAGI is the other. And did you know Medicare had 3 family members?
I did not. Tell me.
They have the stepmother is the IRS and the 2 stepdaughters, Medicare and Social Security. I can see this as the picture from Cinderella, with the stepmother being the evil stepmother being the IRS, and the 2 ones that do what they say is Social Security and Medicare. And I guarantee you nobody's ever said that on a podcast.
Probably not.
First. Yeah.
You're probably right. So today, Mike from Oklahoma City writes to you, Toni, and the title of this edition of Medicare Moments is, Why is Medicare Part D's IRMAA, that's IRMAA, why is Medicare Part D's IRMAA premium so high? Dear Toni, I'm turning 65 in June, self-employed, and my income together with my wife's is over $300,000. Recently, I received a letter from Social Security telling me that my monthly Medicare Part B premium of $174.70 would double to $349.40 per month due to 2022 reported income. That was no surprise, but Social Security also said that the monthly adjustment for prescription drug coverage would be an additional $33.30 a month. What is this all about? I am in excellent health and take no prescriptions. If I do not apply for a Medicare prescription drug plan, do I still have to pay the extra $33.30? Does applying for a Medicare Advantage plan, including Part D, instead of original Medicare and a Medicare supplement, help me avoid the additional $174.70 per month for Part B and the $33.30 per month extra premium for Medicare Part D prescription drug plan? Thanks. Mike from Oklahoma. Wow, what a question, Toni. That's a big question.
Is that confusing or what?
It is.
You know, all this happened in 2010 when they made it so that Part D had an extra premium. And people thought when they were paying their Part D, as in dog, that's your prescription drug plan, you have a separate Part D plan. And then all of a sudden they had to pay extra. So they thought they had 2 Part D plans. They didn't realize that they were having to pay extra because of income. And that, like I said, that started in 2010. So IRMAA, which is one of Medicare's girlfriends, we got MAGI and IRMAA. And IRMAA stands for Income Related Monthly Adjusted Amount. And that is based off of your income. How much money you make. The more you make, the more you're going to have to pay on Part B and also Part D. And why should they make this so confusing? They really look at how much money we make and they know exactly what's going on. So the IRMAA rule, like I said, started it began January of 2011, and that's when all the extra premiums were increased due to what your income level is. So, you know, it's just not fair, and people don't understand. We all want to make money, but if your income is higher, you will pay for it. He's self-employed. He's going to have to pay.
So he is. He's self-employed. He's going to have to pay. But things can change. And the issue is that Medicare looks back. They're at least a year behind on your stated income, right, Toni?
They look back at least, like for right now, we're at 2024. They're looking at 2022.
2022.
2025, they'll look at 2023 because that's the last tax statement that was ever filed, the last IRS April 15th fund day.
And you can have a life-changing event that affects your income. And so even though they are that far behind, as Toni explained, that's when it's good to know people like Toni King, because there's paperwork you can file to bring things up to your current income level that can really help you along in a situation like this. We are talking about IRMAA and Medicare. And IRMAA in this case is spelled IRMAA, income-related monthly adjusted amount premiums, and how that affects you depending on how much money you are earning. It's Medicare Moments. Toni King is your host, recognized by feedspot.com as one of the best Medicare podcasts in the US of A. And that's because of the hard work that Toni does to make these podcasts every week for you come alive. And we'll be back right after this.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Medicare Moments is the podcast. Toni King is your host. We're talking about income-related monthly adjusted amount premiums. And Toni, so we're talking here with Mike from Oklahoma City and what he has to pay. So what is your advice to him as he moves forward with his Medicare sign-up?
Well, Mike is very healthy and he doesn't take any prescriptions. And he's turning 65. He's self-employed, so he's not covered under a group health plan. He really needs to enroll in Medicare. And not just Part B, as in boy. He needs to get a prescription drug plan, a Part D plan. Because if he doesn't, then when he gets one down the road, he's going to have a penalty. And, even though you're not taking any prescriptions, you get the lowest prescription drug plan that is at that time. But you're still going to have that IRMAA premium that's going to pop up. His is $33.30. There's nothing he can do about it. It's better that he gets it now than wait. If he waits 5 years, Medicare gives you a penalty for each month that you wait. 5 years is 60 months. So your penalty will be 60 months times whatever that penalty amount is, 34 cents, 50 cents, whatever. I mean, it just keeps on going. So I would advise Mike to go and get the lowest prescription drug plan he can get. And there's nothing he can do. He's self-employed. He's making high income. And he needs to realize that if he does not enroll in a prescription drug plan, and now he needs one, now he's got health issues, he will have to wait until Medicare's annual enrollment period, which is October 15th through December 7th. All of this information about your prescription drug plan, how to enroll in Part D, how to enroll in Part B, we have all those rules in my Medicare Survival Guide Advanced Edition, and they can get it at the Toni Says website, and we have discounts for people because America needs help.
They do. And I want to tell the folks how to get that information. That's TONISAYS.com. You want to visit that website and you can take advantage of the books that Toni offers there, the webinars that Toni offers there. And also you can contact her and email her info at tonisays.com, TONISAYS.com. And then you can schedule a Toni Says Medicare consultation. And when you do that, Toni and the team are careful to personalize your Medicare Medicare Part D planning, because once enrolled, you can't change until the Medicare annual enrollment period, which is between October 15th and December 7th each year. You can read about that in Chapter 5 of Toni's Medicare Survival Guide, Advanced Edition, and it explains the Medicare Part D in detail. But you want to make sure you have your Part A, your Part B, and your Part D all lined up for what's exactly important for your health needs today. So think about this. Planning is really your best partner in something like this. And yes, Toni?
And one thing people need to realize, sometimes people enroll in Medicare. You get Part A and B, and you get a Medicare supplement with the individual Part D plan, prescription drug plan. But some people get Medicare Part A and B and enroll in a Medicare Advantage plan that has prescriptions. Either way, standalone or with a Medicare Advantage plan with prescription drugs, you're still going to run into Medicare's girlfriend, IRMAA. She is going to come visit you and want more money. It does not matter. So whether you get your Part D as a standalone plan or with an Advantage plan, you still can get the IRMAA extra premium that you have to pay, or penalty, whichever way you want to look at it. So, email us, call us. We're here to help you. We're American, right? We're red, white, and blue.
Right. And that number is 832-519-8664, 832-519-8664. And the website is tonisays.com, TONISAYS.com. Thanks for joining us, America, for this edition of Medicare Moments. Toni?
Well, I will see you later, Jim. We got more podcasts to do, so let's get rocking and rolling. Talk to you later. Bye. Hi, I'm Toni King, host of Medicare Moments podcast. Join me every Wednesday as I share tips, strategies, and little-known facts I've learned over the past 20-plus years. I put Medicare into people terms, and I want to help you personalize your Medicare, because with Medicare, it's what you don't know that will hurt you. Medicare Moments is available now anywhere you listen to podcasts.